Good evening, everyone, and welcome to our forum discussion on artificial intelligence in medicine and the future of human judgment. As AI continues to integrate into our healthcare, many are questioning whether it will eventually replace human decision-making in patient care. So tonight, our panel of experts will explore this critical issue. So the duration of our forum will be around 25 minutes. And let's begin with introduction. I am DIAN as your moderator for this forum. Okay, so let's start by introducing our esteemed panelist, Dr. YING. So, Doctor, could you start by telling us a bit about yourself?
Good evening. I'm Yijing, an AI specialist in healthcare. I develop, deploy, and maintain AI systems tailored to medical applications. I also work with clinicians to identify problems AI can address, such as reducing diagnostic errors and predicting patient outcomes.
Thank you, Dr. Yijing. So here we have our senior physician and medical educator, Dr. AFIFAH. So, Doctor, do you mind to introducing with us about yourself, Doctor?
Okay. Thank you, Dian. Okay, my name is Dr. NURUL AFIFAH. I'm a senior physician and also a medical educator. Currently, I work at Hospital Tengku Awak Afzain, and I used to educate public about health issue and health content. And actually, it's great to be a part of the panel for today's forum.
Nice to know you, Doctor. Next, I would like to call our clinical psychologist, Dr. SYAKIRAH. So, Dr. SYAKIRAH, would you care to tell us more about yourself, Doctor?
Okay, I am Dr. IRDHINA, a clinical psychologist with 8 years of experience in Kuantan, Pahang. And thanks for inviting me to join these insightful discussions.
Thank you, Dr. SYAKIRAH. So, how about our health policy expert, Dr. INTAN? Dr. INTAN, can you give us some of your background about yourself, Doctor?
Okay, good evening, everyone. I am Dr. INTAN, a health policy expert with 10 years of experience in bridging the gap between healthcare systems, medical practice, and policy formulation. So my focus has been on creating equitable, sustainable, and innovative health policies that enhance patient outcomes and access to care. So in recent years, I've been particularly interested in how AI is transforming healthcare delivery from predictive analytics to personalized medicine, and how we can develop policies that ensure these technologies are integrated ethically, responsibly, and inclusively. So today I am excited to share insights on how we can align policy frameworks with the rapid advancement in AI to create a future where technology truly serves the health and well-being of all.
Thank you, Dr. INTAN. Okay, so for me, the artificial intelligence is actually a rapidly evolving field of technology that seeks to create system which is capable of performing tasks that typically require human intelligence. So these tasks range from problem solving and also decision making, and can be pattern recognition to more complex functions. So the significance of this AI extends across diverse sectors, including the healthcare. For me also, these AI applications in healthcare are diverse and impactful. So here is the question for Dr. Yijing. As an AI specialist in healthcare, what are your thoughts on AI replacing human judgment in the patient care?
My view on this is that AI has undoubtedly transformed medicine, enabling more accurate diagnosis, personalized treatment plans, and improved efficiency. However, it is important to understand that AI is an augmentative tool and not a replacement tool for human clinicians. For example, in radiology, AI tools like deep learning algorithms can identify abnormalities with remarkable precision, significantly reducing diagnostic errors. However, a radiologist's expertise is still essential to interpret the findings and apply them within the patient clinical context. One noteworthy example is the IBM Watson Health, which assists oncologists in identifying treatment options by analyzing vast datasets of medical literature. Yet, the oncologist ultimately decides the best course of action, combining AI insights with their clinical expertise. The future lies in this synergy between the technology and human judgment, where AI enhances human decision-making rather than replacing it.
Thank you, Dr. Yijing. That's a very interesting point from you. But I want to ask, what about the argument that AI, given its ability to process vast amount of data quickly, so may one day outperform human doctors in diagnosis and also for treatment planning? Do you believe there could be a tipping point where AI surpasses human capabilities, Doctor?
That's a valid question. Well, AI can process data faster, but medicine is not just about data. It's about applying clinical experiences, ethical considerations, and patient context. AI lacks the ability to consider the nuanced aspect of care and does not have empathy, such as understanding a patient's personal fears, values, and concerns. Even if AI becomes more advanced, human oversight will always be necessary to ensure compassionate and holistic care to the patients.
Thank you, Dr. Yijing, for your sharing. Next, I would like to ask Dr. AFIFAH. You, as a senior physician and also medical educator, so do you see there is any challenges in integrating AI with human judgment, Doctor?
Okay. Thank you, Dian, for the good question. I would say it is absolutely yes, because AI is highly effective in analyzing data and in identifying patterns, but also, it also has some limitation. The primary limitation is that AI models depend on the quality and the comprehensiveness of the data that are trained on it. In rare or novel medical cases, such as the COVID-19, in the early days of the COVID-19, AI struggles due to the insufficient training data. Additionally, medical decision-making involves more than just clinical data. It requires understanding to the patients, holistic, including emotional and social factor. This is something that AI cannot do, making human oversight indispensable. And also, I would to add on that, based on what I have read, it is a publication from the National Institute of Health. It highlights the influence of social bias in AI model used in hospital decision making. The study emphasized that AI synthesis trained on incomplete or unrepresentative data can perpetuate existing bias, leading to suboptimal or even harmful outcome to the patients, particularly in the context of the rare disease. This finding underscores that the critical needs for human oversight the ensure of ethical and effective medical decision making. That's all.
Thank you, Dr. Afifah. So, in your experience, what are some real-world scenarios where this AI has faltered due to its limitation?
Okay. One of the real world scenario is a AI-driven diagnostic tool for a rare disease. This tool works well for a common condition, but it struggles when faced with the rare or newly discovered disease. Like I said before, COVID-19. It is because it lack of sufficient training data. And another example is AI-powered chatbot providing mental health support. While they can offer basic guidance, they lack the emotional intelligence to detect when a patient is in crisis and needs for human intervention. This example highlight why AI should always complement rather than replace human clinicians.
Nice point from you, Dr. Afifah. Next, I would like to ask Dr. Shakirah from her psychological perspective. So, Dr. Shakirah, how important is human interaction in medicine, and can AI replicate it, Doctor?
Okay, thank you, Dian, for your question. Human interaction is actually a fundamental to patient care. So I could say that because empathy, trust, and also communication, it significantly impact the patient outcomes. AI may provide the treatment recommendations, but it lacks the ability to emotionally connect with the patients. For example, delivering a terminal diagnosis requires not only clinical expertise, but also compassion and emotional intelligence, which is something that AI cannot replicate. There are also many studies show that patients who feel understood by their doctors will adhere better to the treatment plans. This proves that maintaining the human touch in medicine is irreplaceable.
Okay, Doctor. So, would you say that there are any psychological risks associated with reducing human interaction in healthcare through this AI implementation?
Okay, answering your question, yes, definitely. One risk is patient alienation. If AI handles most of the patient's interactions, patients may feel unheard or undervalued. So this could lead to distrust in the healthcare system. Additionally, excessive reliance on AI could erode clinicians' ability to develop the strong patient relationships, leading to a colder and more transactional healthcare experience. Mental health patients, in particular, need human presence and reassurance, something that AI cannot provide. That's from me.
Thank you, Dr. Shakirah. It is very good from your point. Okay, next, Dr. Intan, can you share with us what policy that measures should be in place to ensure that AI supports rather than replace human judgment in our healthcare?
Okay, so thank you for your questions. I think policies must ensure that AI in medicine is transparent, accountable, and also ethnically designed to complement rather than replace human judgment. So the transparency is key. So clinicians need to understand how AI systems make decisions. Developers must prioritize creating interpretable algorithms and providing clear, actionable insights. So, without this understanding, trust in AI tools will remain limited and their adoption in clinical practice will face resistance. So, accountability is another critical consideration. clear guidelines are needed to define who is liable if an AI-driven recommendation leads to harm. So is it the developer, the healthcare provider, or the institution? Addressing these questions, it is essential to ensure ethical use and protect both patients and practitioners from legal ambiguity. So, second one is education, because education also plays a crucial role, because healthcare professionals they have to train to not only use AI tools effectively but also to recognize their limitations. AI is not infallible and cannot replace human expertise in complex or nuanced cases. So, training programs should equip clinicians to critically evaluate AI recommendations and integrate them into their clinical decision making processes. So, there is two. For the last one, regulatory frameworks. So, regulatory frameworks are essential for maintaining safety and trust. So, frameworks like the EU's AI Act, which classifies medical AI as a high risk, provide an excellent model. So, such regulations mandate rigorous testing, ongoing monitoring, and strict compliance with ethical standards before AI tools can be implemented. So they also ensure continuous evaluation to address new risks and adapt to advancement in AI technology. So by establishing all these three measures, transparency, accountability, education, as well as the regulation, we can create a healthcare environment where AI supports human judgment, improves patient outcomes, and aligns with the core values of medical ethics. So this balance will be critical as AI becomes more deeply embedded in healthcare systems. Yeah, I think that's my opinions.
Okay. But doctor, do you think that current regulations are enough? Or do we need to have stronger policies as AI evolve?
Of course,
What is
definitely.
your opinion, doctor?
Definitely, because current regulations are a starting point, but as AI advances, policies must also evolve, because we need ongoing evaluation to address emerging challenges such as biases in AI decision making and also ethical concerns around patient data privacy. Because as we all know, as AI evolves, the patient data privacy must also have chances to be leaked. So the goal is to ensure AI remains as a tool that benefits healthcare while keeping human clinicians at the center of decision making. Yeah.
Thank you, Dr. Intan. That is the best sharing from you, doctor. Okay. So here we have one question from our audience. So the question is, if AI continues to evolve, do you think there will be ever a scenario where it fully replaces certain medical professions? So I would like to ask Dr. Yijing for the answer. So Dr. Yijing, what's your take on this?
That's a fascinating question. While AI has the potential to automate many routine tasks, such as data entry, preliminary diagnosis, and administrative duties, it is unlikely to fully replace medical professionals. The essence of medicine lies in critical thinking, ethical reasoning, and human connection, areas where AI continues to face fundamental limitation. Based on the research that I have just read, it highlights that AI excels in tasks such as image analysis, predictive analytics, and streamlining administrative workflow, which can significantly enhance healthcare efficiency. For instance, AI-driven algorithms are already being used to detect diseases like diabetic retinopathy and certain cancers with remarkable accuracy. However, these systems function as a tool to augment rather than to replace it. The expertise of healthcare workers and medicine is inherently a human-centered field where building trust, empathy, and understanding between clinicians and patient is crucial for effective care. Ethical dilemmas, nuanced decision making, and personalized treatment plans require the irreplaceable judgment of the human professionals. As AI continues to evolve, the roles of healthcare workers will likely shift. By automating repetitive and time-consuming tasks, AI can free up the physician and clinician to focus on more meaningful aspects of patient care, such as active listening, education, and addressing emotional well-being. So, this collaboration between AI and healthcare professionals can ultimately lead to a more effective and compassionate healthcare system.
Nice answer from Dr. Yijing. Okay, so let's conclude with a final round of thoughts. So I would like to ask, where do you see AI in medicine a decade from now? So I would like to ask Dr. Yijing first.
Yes. So my take on this is that AI will become an indispensable tool in healthcare, especially in diagnostic and personalized treatment. With advancement in deep learning and big data, AI will improve predictive analytics and early disease detection. However, the key will be integrating AI without diminishing the clinician role. So, AI should serve as a supportive mechanism and not a replacement for human decision making. That's it for me.
Thank you, Dr. Yijing. Now I would like to ask Dr. AFIFAH for your opinion, Doctor.
Okay, DIAN, for your question, how I see AI in medicine a decade from now. From my point of view, I believe that AI will enhance medical efficiency by automating time-consuming, such as documentation, billing, and scheduling. Also, free up healthcare provider to focus more on patient interaction and care. However, we must be cautioned not to over-rely on AI, especially in critical decision-making. Training and ethical guidelines should be continuously updated to ensure that AI is safe and responsible use in medicine. That's all.
Thank you, Dr. AFIFAH. Okay, so next I would like to ask our clinical psychologist, from your opinion, Doctor, do you mind to share with us?
Okay, yes, of course. From my perspective, in the coming years, AI will continue to refine the mental health diagnostics and treatment recommendations. However, it will never replace the need for human empathy, communication, and also trust between doctors and patients. As what I've said before, it is crucial to understand that mental health care is deeply rooted in human interaction. These human elements are irreplaceable because they create a safer space for patients to express themselves and also feel understood. I still agree with the advantage uses of AI, which it can provide valuable insights and so on, but the emotional and psychological well-being of patients must remain a priority. That's for me.
Thank you, Dr. SYAKIRAH, for sharing with us. Okay, so Dr. INTAN, how about your point of view? Can you share with us a bit?
Okay, so from a policy perspective, I see AI governance becoming more structured with global regulations ensuring ethical AI deployment in healthcare. So the challenge will be balancing technological innovation with legal and ethical considerations. If it implemented responsibly, AI can be a game changer, but human judgment must always be at the core of medical practice. So I think that is all for me.
Thank you, Dr. INTAN. Okay, so this is the end of our forum. So thank you to all our panelists for this insightful discussion. So to conclude, AI is a powerful tool, but as we have heard today, human expertise remain essential in medicine. So let's continue to innovate responsibly and ensure that patient care remains at the heart of all advancement. So thank you and good evening, everyone.